So our first case is an 8-year-old boxer, and this dog collapsed in the park an hour ago whilst out walking with his owner. So the dog is brought to your clinic, you run an ECG, and this is what you see. So don't worry about trying to work out heart rates or certainly measure anything, but I just want you to have a look at the trace, and always good to try to identify, do I see something that looks relatively normal, and I can use that as my sinus rhythm, and then I can compare what I'm seeing to try and work out if it's supraventricular or if it's ventricular. Is it a bradycardia or a tachycardia? Is it a regular rhythm? Is it an irregular rhythm? Ask yourselves those types of questions. And I've put up some possibilities here. So see whether you agree with any of these. So do you think it's ventricular tachycardia, complete AV block, sinus tachycardia, or atrial tachycardia? And I'll give you a few, another 10 seconds or so just to have a look at this, and then we'll go through the answer. So, okay, I think at this point probably most of you have voted. So what we'll do is I'm just going to broadcast the results here and see. So the vast majority of you decided or thought it was ventricular tachycardia, and that's absolutely right. What's important is that you picked up it's a tachycardia, so the distance between those R2R intervals is very small. So let me just get my little pointer here. So here is our period of what we're going to call sinus rhythm. Okay. Now, because this is measured at 25 millimeters per second, it's quite a fast paper speed and it's a fast heart rate, so everything looks bunched together. What you might like to do in this situation is run it at 50 millimeters per second, spread everything out, it'll be much easier to see. But anyway, this is a real life example, that's what we measured it in. And you can see here that we have probably 7 or 8 sinus beats, and then all of a sudden the rhythm changes. It becomes faster, but our QRS complex looks very different to these. So that's how we know that this is not an atrial tachycardia. We know that it's got to be a ventricular tachycardia because the QRSs are wide and bizarre and they look different. We also know that it's not a bradycardia, so it's not complete AV block, because that would give us a very slow rhythm, which this clearly is not. So this is over 300 beats per minute here. For those of you that have an interest in cardiology and know a little bit about boxers, you'll know that they are prone to ventricular tachycardia as part of their dilated cardiomyopathy spectrum. We call it arrhythmogenic right ventricular cardiomyopathy in boxers. So those of you that said ventricular tachycardia, that's excellent, well done. So what are we going to do in this situation? Well, if you were presented an ECG like the one we've just looked at, clearly we're not going to send that dog home with just oral medications. That has to be dealt with as an emergency right there and then if you can. And most people will have some lignocaine in the practice. So you're going to start off by giving intravenous lignocaine, and you can do that as 2, 3, up to 4 boluses before starting a continuous rate infusion. And that's a pretty effective drug to control that rapid, really malignant looking ventricular tachycardia. If we don't control it, that dog's at high risk of sudden death.